Hello, good evening. My name is Dr. Chidi Ufondu of Snowspirations Global Health Solutions. I hope you're enjoying your weekend. I hope you're having some downtime with the family. Today, it's a big day in our group, and in our YouTube channel this evening, we're going to talk about a very important topic. We are going to talk about bleeding in pregnancy. Bleeding in pregnancy. So we're going to look at 5 important things to note about bleeding in pregnancy. Bleeding in pregnancy is something that it's pretty common, and it's something that can freak you out, especially if you're a first-time mother, because by default, when you're pregnant, you are not supposed to bleed. The way the body of a woman is structured, the way the womb is structured, the way the reproductive system is structured, once pregnancy is achieved, you are not supposed to bleed. So it's important you understand that bleeding in pregnancy is abnormal, but it's common. That's number one point to know. Now, let's have a quick recap on what happens when you're pregnant. So once pregnancy is confirmed, when the egg comes out, enters the tube, goes to the ampulla, the sperm comes in, and there is successful implantation of the embryo in the womb, the whole pathway that leads to your monthly bleeding will cease. So all those hormones that will make you to bleed will stop functioning in the way that will lead to bleeding. Why is this important? In the first place, the reason why you bleed is because there is no pregnancy. So the body of a woman is structured in such a way that every single month you are supposed to be pregnant. So every month you're releasing your eggs, the womb is already preparing to receive the embryo. Now, when that doesn't happen, about 14 days, you will bleed. This is what happens. So in a woman that has a 28-day cycle, it takes you about 14 days to realize that you are actually not going to have a baby. Then the cover of your womb, which is called the endometrium, will break down and shed off. That's what happens when you bleed. Now, when you become pregnant for sure, exactly the role the womb beats, structure to play will kick in. So you don't bleed in pregnancy. So all forms of bleeding in pregnancy is considered abnormal. So number one point to note this evening is the fact that when you're pregnant, you don't bleed. Very, very, very important. So though it's common, we have to be careful and we have to report to the doctor immediately. Now, like I taught you guys yesterday, this bleeding might be a bleeding we're not supposed to worry about, which is called implantation bleeding. But please, in as much as implantation bleeding can happen, implantation bleeding is the type of bleeding that can happen from within the time fertilization occurred up to 14 days. So it's a light form of bleeding or spotting. It occurs from about 1 to 2 weeks after fertilization when the embryo is implanted. So bleeding in pregnancy can be due to implantation bleeding. And it's okay. It's not something that will freak you out. But please, all bleedings in pregnancy are treated as emergency. So whether it's implantation bleeding, whether it's chemical pregnancy, whether it's molar pregnancy, whether it's ectopic pregnancy, whether it's missed abortion, whether it's any form of problems in pregnancy, we have to find out ourselves. So your duty as a pregnant woman is to be on the lookout. So all forms of bleeding must be reported to your doctor. So because of the fact that bleeding sometimes in pregnancy might be serious, it's important to know the possible cause and get checked by your doctor and make sure that you and your baby are in good condition. The number 4 point I want you to take cognizance of this evening. Unfortunately, some women will lose their pregnancy. So sad. Now, top on the list of presentations of miscarriage is bleeding. So miscarriage is the unintended loss of your pregnancy before 20 weeks. If you lose your pregnancy beyond 20 weeks, it's called stillbirth. So stillbirth is just miscarriage that happens on the other side of the divide. So sadly, most miscarriages happen in first trimester. So the commonest period you can also bleed in pregnancy is the first trimester. So because miscarriage is commoner about the first 12 weeks, and it tends to be one of the biggest concerns in first trimester bleeding, we have to take all forms of bleeding very serious. First trimester bleeding doesn't necessarily mean that it's all due to miscarriage. There are so many women that will bleed, they will still end up having their baby. Matter of fact, 15 to 25 of pregnant women out of every 100 pregnancies will bleed. And all this bleeding will happen about the first trimester. The majority of women will still go ahead and have their baby, especially if we discover on ultrasound that we still have a heartbeat in that pregnancy, in that baby. Most women that had vaginal bleeding will not miscarry. So the fact vaginal bleeding might be a sign of miscarriage doesn't necessarily mean that once you bleed, you will miscarry. Now, the final point I want us to highlight on, there are so many things to talk about bleeding in pregnancy, but I want you to also note that bleeding in pregnancy might be due to molar pregnancy, or what we call gestational trophoblastic disease. Bleeding in pregnancy can also be due to ectopic pregnancy, when pregnancy is happening outside the womb. So if you have pregnancy existing in the tube, it's called ectopic pregnancy. It can lead to bleeding. Some women can have what we call chemical pregnancy. Now, in pregnancy, there are changes in the cervix. Because of all these changes in the cervix, it makes a woman prone to having bleeding. So cervical changes can also be the reason why you bleed in pregnancy. Some women can also have infection. So in your pregnancy, if you have an ongoing infection, it can present with bleeding. Now, importantly, most bleeding in second part of the pregnancy, which is second trimester, is due to placental problems. So you can have what we call placenta previa, or you can have placenta abruptio, or you can have vasa crater. These are all problems that has to do with the placenta. So if the placenta is not implanted properly or is dividing too early, it can lead to bleeding in pregnancy. Now, of all the forms of bleeding in pregnancy, the one that is really, really, really dangerous, that must really freak everybody out, is what? Uterine rupture. So when your womb ruptures, it can lead to overwhelming bleeding that can kill the woman. So this, in a nutshell, are the things that might likely cause bleeding. These are the facts in pregnancy that might lead to bleeding. So bleeding is something we need to investigate. Now, one of the things you can do by yourself to make sure you're not prone to bleeding is what? To stay hydrated. So in pregnancy, when you are dehydrated, you are prone to having bleeding. And bleeding is something that you don't need to wait till the following morning. So if you notice you're bleeding by 12 a.m., you ring your doctor and you go to the ER. It's not something that can wait, because if miscarriage is about to happen, and if there are a couple of things we can do to prevent that miscarriage to happen, the earlier you get to the hospital, the better. So it's important that all forms of bleeding are communicated to your doctor almost immediately. Then afterwards, you take yourself to the doctor. Now, one of the other things I normally tell my people, once you notice bleeding in pregnancy, there are 3 S's you must observe. Number 1, no sex. So you are no longer a candidate for sex. Number 2, no spots. So in as much as you are still encouraged to kind of ambulate, so you still need to walk around a little bit, but no strenuous exercise, no going to the gym, no running. You are practically gonna be on what? Bed rest. There are some women we can subject to complete bed rest. The last S you have to observe is what? No stress. Unfortunately, some women stress a lot, and any form of stress can increase the possibility of having complications in your pregnancy. So no sex, no spots, and no stress. Very important. The essence of doing this is to make sure we have a good outcome. The overall aim of pregnancy, the ultimate aim of all pregnancies, is to deliver the woman, is to make sure the baby is alive, is to have the father happy. So the three parties should be happy. So when a pregnancy is not complete, maybe the mother had complications, the baby has complications, the father is freaking out, then it's not a successful pregnancy. The last thing that happens in the delivery of a baby is what? Delivery of a placenta. So once the placenta is delivered, that pregnancy has ended. So please, one of the things you can do to make sure you have very good access to your doctor when you're pregnant is to make sure you go for your ANC regularly. Once you are confirmed pregnant, make sure you confirm your pregnancy. The clinical confirmation of your pregnancy is ultrasound. We need to make sure that that baby is existing right inside the womb. Once the baby is developing inside the womb, and when the time comes for us to hear the heartbeat, once you hear the heartbeat of the baby, even when you bleed, you can still have your baby. Okay, so thank you this evening, and I'm going to quickly allow you to ask your questions in the next few minutes. Then we're going to interact and we're going to enjoy our weekend. So please feel free to ask your questions. The clinic is open for questions. So go ahead and ask your question. If you're currently pregnant, I also have a poll. If you're currently pregnant, please indicate if you are currently pregnant so we can see how we can attend to you. So, okay, I believe the poll is ended. Okay, that's okay. So please go ahead and ask your questions. If you have any questions, feel free to ask any question whatsoever. So even if your questions are not directly related to this topic, these few minutes we have is an opportunity for you to ask me questions. Okay? Do we have any questions? Remember, all the topics are generated organically. That means we touch base with our members. Whatever concerns they have, we use it to teach. Okay, so the first question says, does bleeding in pregnancy mean that there is a problem? Yes or no? Yes and no, sorry. So here's the deal. There is a type of bleeding we call implantation bleeding, right? So that's the safe form of bleeding. When the embryo is implanted in the womb, there might be one or few things and you will bleed, okay? So that type of bleeding is what? Completely okay. Now, what we want to do is to consider all forms of bleeding as an emergency. So it's better you come from a place of emergency so that at the end of the day, we can tell you, oh, don't worry, it's implantation bleeding. Matter of fact, implantation bleeding will last for just about 24 hours. In some cases, just 2 days. So yes, bleeding in pregnancy should be considered a problem. So we can investigate and discover if it's molar pregnancy, ectopic pregnancy, chemical pregnancy, placenta problems, womb rupture. So we need to know. And the time you are bleeding in pregnancy is also important. If you are bleeding in first trimester, we are more worried about that because that's when miscarriage will happen. If you are bleeding towards the end of your pregnancy, guess what? Once we get to 37 weeks and you begin to bleed, what are we going to do? We're going to bring the baby out. So there are so many babies that might not be delivered on the expected date of delivery, the EDD. So if you go to your ANC, we normally give you some dates. Guess what? Those dates are not fast, like a day, oh, this is the right date you will deliver. No, your baby can come 2 weeks before your EDD or 2 weeks after your EDD. Our aim in pregnancy is to make sure we advance that baby up to 37 weeks. Any baby that gets to 37 weeks is classified as STEM. What's the implication of getting to 37 weeks? Once you get to 37 weeks, we can, check you and your baby and you guys can go home as soon as possible. But if your baby comes before 37 weeks, we are going to take the baby to the neonatal intensive care unit. That's where babies that came before 37 weeks are kept. Those babies are called premature babies, okay? Very important. Okay, thank you so much, Ebenezer. Very good question. Good evening, Doc. It's folic acid 5 milligram, the same as 400 microgram. No, my sister. 5 milligram, it's much, much bigger than 400 microgram. So be careful. Now, what you need in a pregnancy, or if you don't have any need for more, if you are just warming up to be pregnant, the quantity of folic acid you need, which most times will be contained in the prenatal multivitamin is what? 400 to 600 microgram. So 5 milligram, it's way higher than 400. Microgram is lesser than milligram. So if your doctor didn't find any rationale to give you more, please stick to 400 to 600 microgram. Thankfully, you are not supposed to isolate the folic acid and take it alone. The folic acid is already contained in the prenatal multivitamin. So what you need to do is to take it religiously every single day, starting from 3 months before the period you're anticipating to become pregnant, then throughout your pregnancy. But the most important period to take your prenatal multivitamin, it's within the 3 months of pregnancy. So that period of 6 months is important. But we normally tell women to take it completely. You don't have anything to lose. Can problems with the placenta cause bleeding during pregnancy? Yes, that's top on the list of things that can likely lead to bleeding in pregnancy in the second trimester. Number one, it's what we call placenta previa. So if the placenta implants very close and low lying to the point that it covers the cervix, when this happens, it can lead to some form of bleeding, and that can be a concern. Now, some women can have what we call placenta abruptio. So before placenta should detach from the body of a woman, which is part of what happens when you go into labor, in some women, the placenta will detach very early, leading to the condition we call placenta abruptio. That's deadly. That's an emergency. It comes with extensive bleeding that if care is not taken, we can lose that woman. The problem in pregnancy is the fact that anytime there is bleeding, if we are not careful, we lose the woman. So there are unfortunately women that died on the table. But in this era of 2021, no woman should die bringing forth her baby. It doesn't make sense. This is why you need to be careful. If you attend all your ANC religiously, you will not have a problem with your baby. Because the essence of ANC is to keep an eye on you, keep an eye on your baby, and make sure that both of you are going okay. That's what happens when you go for your ANC. Very important question. Can a pregnant woman in her first trimester travel on a journey of more than 5 hours to and fro after confirming experiencing spotting? Okay, now, my sister, you have a problem. What's the problem? What we are talking about today. So whether you're spotting, whether it's light, once you have any evidence that blood is coming out, please readjust. Personally, I will not subscribe to you traveling for 5 hours. Do you know why? The possibility you're gonna be stressed in this trip is very high. The possibility your stress level is gonna be up, it's very high. The possibility anything can happen during this travel is very high. And you are spotting. If you were not spotting, definitely you can travel within your first trimester. The period we don't allow women to travel in pregnancy is from 36 weeks up. So if you are planning to fly to come for medical tourism, maybe you want to come to America to have your baby, you must make sure you are already in America before 36 weeks. It's not advisable to travel about that time because anything can happen. And remember, when you get to 36 weeks, your baby is good to go. So we should protect our babies. You can postpone this trip. If you don't embark on this trip, nothing will happen. So personally, since you are spotting, ring your doctor, go in, let's check and make sure that everything is okay. Matter of fact, I will personally ask you to go on extended bed rest. Okay? Because you notice in Nigeria, it costs much, but why bother taking more when you don't need it? Okay, so personally, stick to what I advise you to take, okay? Now, if you have a need, your provider will give you more on need basis. So there are some women that might need additional prescription folic acid. But if you don't have a need for that, you don't take it. So in as much as you might not really have a very bad adverse effect or side reactions when you take more, I will personally ask you not to take more. Just take what you should take. Okay? All right. Let's continue. Please keep asking your questions. Let's quickly wrap up. Okay, so if you have more questions, feel free and ask your question. Temi Ruth, thank you so much for those questions. Ebenezer, thank you so much. Can bleeding